Welcome, everyone. My name is Therese Stone with the McKenzie Foundation Community Relations Committee. I'll be serving as the moderator for today's town hall event. We're hosting these events for our community members, and we're so glad you joined us. I'd like to start by introducing our panel for today. We have Dr. Mark Hammond, who's our McKenzie Emergency Department Medical Director, Steve Barnett, McKenzie President and CEO, Bryant Wilke, Health Officer and Director of Environmental Health from the Sanilac County Health Department, and Dr. James Sams, McKenzie Family Physician. So a couple housekeeping items before we get started. First of all, your audio is automatically muted. You need to use the Q&A function at the bottom of your screen to ask a question. The town hall will be recorded and a link will be sent to you in a follow-up email. The topics for our agenda for today include a COVID-19 update, vaccination options for Sanilac County, and how to be proactive rather with your health. And then we'll have a time for question and answers. So Dr. Hammond's going to kick us off by sharing hospital updates for our community.
Good morning, everybody. Thanks for attending. So we are in month number 11 of the pandemic officially, maybe 12. I'm not sure where we are right now. However, as a community, we're doing relatively well. You know, what we're worried about at this point is the post-holiday surge of cases that might come, because we assume during the holiday season people have, you know, probably got together, and there's a chance that some of those people who had COVID and didn't know they had it spread it to others. And the worry now is, will we see an increase in the number of patients who are positive for COVID, and then will that require patients to be hospitalized for COVID? So we're kind of on guard for that. Now, excitingly enough, we have vaccines available now. So there are 2 vaccines that are approved by that are given emergency use authorization approval by the FDA to be on the market in the US. And those are really game changer for vaccines. One of them is a Pfizer vaccine, the other one's a Mrna vaccine. Those are companies. And these are really unique vaccines. And the way they work, so viruses have, just like all of us, they have what they call a DNA and RNA complex and kind of like genetic codes. And what's different about this virus compared to others, about this vaccine, is because other vaccines in the past, the way that you get vaccinated is they actually probably inject into a dead or deactivated piece of a virus into your body, and that causes your body to kind of recognize it and build up antibodies and attack it. What they did with these 2 vaccines, so what they're called mRNA vaccines, is scientists took a part of the messenger part of their RNA, which is kind of like genetic code, put it in a small nanoprotein lipid, so it can be injected into our body. And what that does is it fools our body into thinking, hey, look, there's something here. It's a viral particle called the spike protein. And our body's saying, hey, this isn't normal for our body. Let's attack it. So they build these antibodies to prime up and to fight against the spike protein, which is a killer part of the virus that makes us sick of the COVID virus. So in the future, so after we get vaccinated, we're kind of all the antibodies are built up. When our body's exposed to COVID, you know, through community exposure or whatever, our body can actually recognize the virus and attack it. So that's kind of the beauty with these new vaccines, that they're not actually putting a virus into you. They're just putting a messenger, kind of like a little protein that tricks the body into thinking it's a virus. So it's a very effective way of building up immunity through vaccines. Now, in these vaccines, what we're reading about them is the side effect profile is very minimal. So anytime you get an injection, you know, we always tell patients you might have some muscle pain the next day, some soreness around where you got the shot. And then as compared to some other vaccines, so the flu vaccine, some people say they got sick with the flu after the flu shot. They didn't get sick with the flu, but they had side effects that are common after certain vaccines. So similar to the flu shot, People that get the COVID vaccine, they might get some fatigue for a day or two, some muscle aches and pains, some joint pain, maybe a headache, maybe a fever, but these are very mild and they shouldn't last for more than a couple of days. But that's really it. And we're thinking that long-term wise, because usually if there's not a reaction that happens after 2 months, the reaction is unlikely to happen, period. And they have not seen any reactions after a 2-month period. The vast majority, 95% of reactions are within the first week. 99% of those are within the first 3 days. I had my my COVID shot, and for the first couple of days, I felt a little kind of tired. Took a nap, throughout the day once, and had a headache on day number 3. And I took some Tylenol, and that was it. A colleague of mine had his COVID shot, actually had her COVID shot, and she had nothing at all, no side effects at all. So I was a little jealous of her. So it affects everybody differently. But the safety profile is very safe from what we're reading. The way it works with the Pfizer vaccine, you get a shot, and then 3 weeks later, you get the second dose, the second shot. And then 2 weeks after that, so about a week or two after that second shot is when your immune system's supposed to be really at tip top, 95% effective. I'm ready to fight this virus if it comes to me. The Moderna shot is a shot on day 1, and then you repeat a shot on the 4th week. So that's 4 weeks apart. And then again, 1 or 2 weeks after the second shot is when your body's supposed to be really primed up and ready to fight this virus. So really, it's a virus that's killing people left and right. It's the 3rd leading cause of death throughout the country. So this virus is going to hopefully help prevent this unnecessary cause of death for many Americans, and actually many people throughout the world. Thank you.
All right, this is Steve. I'm going to go ahead and get started. I think I'm next in line. And what I'll try to do is give you a little bit of an update on what's going on at McKenzie. Dr. Hammond touched on some of that. But McKenzie, as you know, we began implementing processes in March of 2020. I'm glad I can say that in my rearview mirror now because it's 21. And we're hoping for a much better year than we experienced in 2020. But our focus has always been on protecting patients and staff from an avoidable contamination. So we've done a number of things over that period of time that allows us to keep everyone safe. So as we have continued learning about COVID-19 and we've adapted and modified our processes, and we do that so that they reflect the latest evidence-based practices. And I think that's important because a lot of times people are concerned that what we said yesterday, we change our mind and do something different tomorrow. We don't do that whimsically or just because we can. We're doing it as a result of what is the latest recommendations from CDC or the Department of Health and Human Services in Michigan. So we continue to adapt and evolve. All of this simply means that the staff at McKenzie Health System are working every day to keep both the hospital open and safe. So you should not let the pandemic stop you from accessing care if you need it. I think later Dr. Sams may touch base on some of the techniques that we're also offering as alternatives to face-to-face primary care visits, as an example. In terms of the vaccine and administration, as many members in the community are aware, and I believe there's a high awareness, probably we've all dove into science at a much higher level and healthcare, particularly as it relates to the vaccine, than most community members have ever wanted to. But that level of awareness is actually good because people are making good decisions about what to do, when to get vaccines, and which vaccine to actually use. I think, in the past, I've heard a little bit about the FDA process, and as Dr. Hammond pointed out, both Pfizer and Moderna came on market first back in December. There were some concerns that process was a little faster than what community members thought it should be. But what's important to know is that both of these messenger RNA platforms that Pfizer and Moderna share have been around for a long time, decades, as a matter of fact. So the technology and the techniques and really programming that messenger RNA to get on the cell and have that spike protein that really motivates your immune system to respond and start creating antibodies. That technique and that application has been around for a long time. So it's really safe, as Dr. Hammett pointed out. And we're lucky that although we couldn't get the Pfizer vaccine early in December, we were able to get the Moderna vaccine. Unfortunately, both of these vaccines require storage at super cold temperatures, one even colder than the other. They're both packaged and delivered in multi-dose vials. And, and the logistics of storing that and getting it out can be complicated. And so for those reasons, we've been diligent in scheduling blocks of people because of the multi-dose nature. We don't want to waste any vaccine. And I'm pretty sure that Bryant from the health department will speak to that similarly as he begins to talk about what we're doing at the county level. I can happily say that we've not wasted one vaccine at McKenzie, and I doubt that anybody who has them, at least in Sanilac County, has had any experience other than the same. The unfortunate part is we received it on December 23rd, so we're going into two major holidays. We've got to figure out how to mobilize a team and develop a clinic setting where we can begin administering and scheduling people and really following the phased-in approach that was outlined by CDC and embraced by the state. So there were a lot of challenges, and we were able to actually overcome those and start getting vaccines into people's arms on the when was it? The Monday after Christmas. So between Christmas and New Year, we began actually administering the vaccines. And again, things have moved along very well. I couldn't say enough about the team at McKenzie. Everybody did a great job of pulling together and figuring out how do we get these people in here, get them scheduled, make sure we know how to contact them for the second dose and when that'll be all done, and get all the paperwork and inventory moving. So it's really worked well, and we just get better and better every day. So we're going to be able to take those experiences as we order our second dose of Moderna, which is due 28 days after the first dose. And we've placed that order now. We should be getting that, I hope, next week. And we've also placed an order for Pfizer. So we have that sub-cold freezer here. We're able to store that, and we'll be able to complement the health department as we work collaboratively with them to really start accelerating how we get vaccines and administered to the community at large. We've been fortunate to be able to vaccinate a lot of the teachers at Sanilac High School. We did that last Friday. That went well also. And so we're eager to move forward, and we're excited about the relationship that we have with the health department. And having said that, I think I'd just go ahead and turn it over to Bryant.
Thank you, Steve. It's always so difficult to follow you because you're so well-spoken. I will just recap a little bit about COVID-19, where we're at county-wise. If you go to the state website, you'll see the dashboard. We're at 1,533 cases. Those are cases that go way back into March. I think Doc Hammett mentioned that, and it's hard to believe we're coming up on a year of working the COVID-19 pandemic, but we are. We've experienced 64 deaths in our community, and our hearts go out to those families and friends that knew these individuals. It's hard to accept that something like this can happen, but it has, and we're working through it. But our hearts do go out with them, and our condolences. Currently, and if you notice the dashboard and the numbers, we've seen significant numbers increase in late October and November. And I don't have an exact number, but we're still managing about 1,000 cases, and those cases are rolling off as their 30 days come due when we can say they're no longer an active case. And that's been a really burden on our department, of course, because that's a significant number to deal with, but we're I'm proud of the health department and our partners like McKenzie that have been working with this all this time to care for our community and our community folks. We're running about a 7.9% positive rate in our testing, and that's community-wide. Currently, we're seeing about 149 tests completed per day. And 7.9 is still up there. And as Dr. Hammett mentioned, we are seeing a bit of a plateau, and we're kind of crossing our fingers that we do not see a bump up in this coming week from the holidays. And that's really key. So that's where we're kind of at in the COVID stance. And fortunately, we're all talking about vaccines now. And just a quick reminder to everybody, even though we have the vaccines and shots are being given, we still have to maintain those mitigation factors of social distancing, hand washing, and as well as wearing a mask. So Steve did a really great introduction of the vaccine. Here at the health department, we received 100 doses, and then we were supplemented with additional 100 doses, but countywide, we received 1,000 doses. And based on my calculations, we're about 100 left or less within the county, and those are being used up pretty rapidly right now. The phases that we're talking about, and when I say that, that was the Mrna vaccine. Phases that we initially started off with were, of course, healthcare and first responders and long-term care and AFC homes. Well, on Monday, we all heard from the governor in the state of Michigan that we opened up what we call 1B phase, which includes daycare givers or workers, law enforcement, schools, and a very large part of our population, those 65 and older. And believe it or not, our phones just rang off the hook. So that's a pleasant thing to know that people out there want this vaccine. And for those that have been calling, we are getting your voicemails, we are getting your emails. Give us a bit of time to get back to you. We are starting to schedule clinics today. So you will be getting a call back, but I can tell you we have 1,500 individuals in the hopper, meaning that those individuals, we will reach back to you and schedule you a time and place. And when we schedule that first appointment, you're also going to get that second appointment for your second dose. And when I talk about, Steve did a really good job about Moderna and Pfizer, we also were very fortunate. We realized that we were going to run out of Moderna, and there's a couple weeks span for Moderna to get back online due to supply chain issues. We ordered Pfizer. We did receive Pfizer this past Monday. We have 975 doses, and those are going to start to go to these clinics I'm talking about for those 65 and older. And we're also reaching out to all the schools to get numbers from them so that we can continue to vaccinate the schools, as well as those individuals out there that aren't associated with a hospital that are healthcare providers. Please contact us if you haven't received your vaccine. We will get you in the hopper and kind of move you up on that ladder, because you're very important to us to get that vaccine, because you're the frontline caregivers in this whole crisis. So please do that. And just to mention, if you do call, our phones are busy, but there is a way you can email us that you want the vaccine, and that is covidvaccine@sanilachealth.com. And I will offer the number too, but be patient on that phone number. We have 2 people scheduling and 3 others taking names and numbers at this time. And that's 810-207-0962. That's 810-207-0962. In the coming weeks, what you'll find too, and this is probably going to help all of us that have internet access, we will actually have a portal on our website that will allow you to make an appointment at the clinic. So what we'll do is put out a clinic and a day of a clinic and how many doses we have available, and you'll be able to put your name, phone number, and birthday in that slot, and that will automatically register you for that clinic. So that's going to be a really time saver, not only for you folks trying to contact us, but also us here at the health department. And with that, I believe I can hand it over to Dr. Sams.
Well, I'm the new one to the committee here, it looks like. So I want to start off by thanking Bryant. I've been watching from the sidelines pretty much throughout this whole thing. And so it's really good to have you in the lead with this and the whole EOC committee. appreciate Steve and Mark, what they've been doing. And it just is it's a good indicator of how well we can work together as a team. It's kind of, if anything, it's inspirational to see where we can go, because, you know, when we work together, we can get a lot more done. So everything that's gone down, I'm really impressive with it. My part of the program was to talk about preventative maintenance. And the thing to drive home is we've had COVID going on for this period of time, but just because that's going on doesn't mean everything else stops. You continue to have high blood pressure. You continue to have diabetes. Other issues still need to be checked. I tend to use a lot of analogies of car when I'm talking about preventative health. And so basically I say that sometimes we treat our cars better than we do ourselves. And so in times of stress like this, people tend to just shut down and go by the wayside. So I'll liken this to being in the middle of like a snowstorm right now. Just because you're in a snowstorm doesn't mean you still can't keep going with your car. You got to change the oil. You got to check the air in the tires, things like that. Same thing with ourselves. Yes, there's some limitations on what we can do. Steve mentioned earlier some of the other options. And yes, other than being seen in the offices, which we are seeing more in the offices now, we do have the access to telehealth, which I think is an excellent thing. And if anything else, just even over the phone, there are a lot of things we can do to do it. So don't let that be the thing. Have a lot of people that just stop taking their meds altogether. We can continue to communicate that way. Again, when we talk about preventative maintenance, we talk about regular monitoring of how your cholesterol is doing, what your sugar's looking like, what your immune system's like. We need to keep doing that. If you're up for a colonoscopy, you can't write a note to God and say, "Well, it was COVID, so I can't have a colonoscopy this season." We need to be proactive all the way around. That's where I go with this. We talk about preventive health. We know that already. Women getting mammograms, all those things. We need to keep that going. I want to kind of focus on something else that we can't do. And when we get into mental health, we can't really talk about putting a dipstick in your head and see where you are. The people I'm concerned about right now, and I see a lot of it, is if you had any sort of depression before COVID, you put COVID on top of it, and then, oh, now we're in this dark time of the year. It really can suck the energy out of everybody. And so it's something we need to talk about. You see across the nation, the increase in suicides, overdoses, and alcohol abuse. Those are some things to be around. So it's not just you that we're talking about. It's if you have someone in your life that's that way. The take-home message is you are in the driver's seat of taking control of yourself. So anything we can do to help. Again, one of the things that's really jumped out about this is how well we at McKenzie have kind of gotten together as far as the primary care providers and the gals in the office to kind of figure out. There was not an algorithm to follow, and so we've had to punt. That said, when we go to this, we didn't have an algorithm to go from, so we have to educate ourselves as we go. And that's the next part I want to talk about is, again, the mental health is such a very important thing that people start second guessing. Normally, rational people start making irrational decisions. Education is essential across your board when you talk about health or anything else. With that in mind, when you talk about our car, you want a guy that's worked on a 69 Mach 1 Mustang and a 2018 Cadillac. You don't want a guy that said, well, I saw a YouTube video about changing oil once. You don't want that guy. Vet the talent that you see. I have people that tell me, and I really think they believe this, that, well, I did a lot of research and their research was the top 5 Googles. And I really don't think that's, also look to see where it's coming from. Now you have very intelligent people that can dive down black holes. So that's why we're blessed here. I mean, Mark's right on the cutting line of everything that's going on as far as immunization research and the therapies that are going. So we're really, really blessed to have the access to things along those lines. When we talk about other things we can put in the mix, and this is something that kind of has come along there's no clear way to prevent you from getting this, but there are a couple things we can kind of put in the mix that kind of stack things in our favor. And that's come to light, use of vitamin C, vitamin D, and a zinc combination. Not to get into all the rigmarole behind that, but what it boils down to, anything we can stack in our favor to boost our immune system to get us through. But again, I keep going back to the mental thing. Don't let the mental stuff get through you. One of my favorite words is serendipity. And I'd like to kind of leave you with this is, I don't know, serendipity is something good coming out of something bad. So the discovery of penicillin, he messed up on an experiment, but he found penicillin. with this, we look at viruses. If you look back at the viruses that were going on in the Spanish flu of 1918 and 1919, it was terrible times. It racked our country, the whole world, some of the most devastating times economically. But right behind that came the Roaring 20s, and it was one of the best times of our economy, and we had so many things that came out of it, so much creativity. That's the serendipity I'm looking forward to this, and if we can keep our eye down the road, that little light at the end of the tunnel, it's not a train. We're going to get there. And it's the ones that are keeping it together and keeping their health mentally and physically together to get through this that are going to be ready for the other side. So anyhow, that's my portion. So.
Thanks, Dr. Sams. At this point, we're going to begin the question and answer period. I see there's already some questions down there, but if you have a question that hasn't been answered, please feel free to enter them in the Q&A function at the bottom of the screen. So let's go to our very first question. Okay, so this question may be for Dr. Hammond. If I get the vaccine, can I be around everyone without worrying about COVID or spreading COVID? Can I still be a carrier of COVID? And will I still need to wear a mask?
That's a great question. So what we know is that unlike the flu shot or unlike other shots where people might feel like they're getting sick with the actual flu, this is not, so the COVID vaccine is not giving you COVID. So you can be around, you will not get people sick with COVID if you get the COVID vaccine, unless you have COVID. So the vaccine will not give you COVID. So there's no reason to not be around somebody else unless you're worried about them being sick already. Now, can you still be a carrier of COVID? That's a great question. We don't know. So when they studied the Pfizer Mrna vaccines, they studied to see if people who got the vaccine got symptomatic COVID, meaning they had COVID and they had the cough, they had the runny nose, they had illness, or they were hospitalized, or even if those people actually died. And what it showed is that almost 100% of people who got the vaccine did not develop severe COVID, which is a great effectiveness rate, up to 95%. Some say up to 100% in some of the studies too. Now, the kicker is, does it prevent the asymptomatic COVID where you don't feel sick, you feel fine, and you're contagious? They don't know that. They didn't study that part of it. There is a strong assumption that you might have protection against that, but they don't know for sure. And until then, they do recommend we still wear masks. We do our distancing. Pretty much assume nothing has changed. And in the back of your mind, you want to assume I'm still in this COVID pandemic. I still have to be very careful. But in reality, there might be more and more data suggesting that we can ease up on some of the measures. But until then, we have to assume that you can still get it and carry it, but you yourself will probably not get very sick with it. And those around you might actually be protected too, to some degree.
Okay, so our next question is, can people who do not reside in Sanilac County receive a vaccine in the county? And if so, how do they go about obtaining it? I guess that sounds like a question for Bryant. Or maybe Steve.
Well, that's a very good question. And actually this question has gone up all the way up to what we call the check, which is the EOC in the state. Because we do have a lot of individuals that work outside of our county or individuals that travel into our county to work. So right now we are accepting those that live outside our jurisdiction. Now you'll see some counties, and I won't name them, but they are saying no, they're only going to do their residents. So we are trying to get a very defined definition for that from the state. It makes it more cumbersome if we do have to stay within our residence because of that, individuals coming in and out of the county. But then there is some argument too that we should just be doing our own residents and maintaining our allocations for those. So we are working out that issue right now. I can't give you a straight answer right now, though. If you are from outside the county and you're working in our community and you're signed up for a shot, we're going to give you a shot. So we can get this process moving and get as many individuals that want the vaccine completed.
Okay, the next question. If a person gets the shingles shot and the COVID vaccination shot within weeks of each other, will it affect the body more, or should there be more time between various vaccinations? Maybe Dr. Hammond?
Sure. That's a great question. So they recommend at least 2 weeks apart after each vaccine. Why? Because they don't want to, they want to be able to determine if a side effect has occurred due to that vaccine or due to other vaccines. So they recommend the 2 weeks apart between vaccines. So we believe that there would not be any kind of severe reaction that would develop, if you get vaccinated 2 weeks apart from each other. As far as if you do it sooner than each other, we don't know. The data hasn't been there to support it. So that's why we recommend the 2 week period between all vaccines, whether it's a flu shot and COVID shot and shingle shot or whatever. Sometimes when you go to your primary care office, you get multiple vaccinations one day. With this vaccine, it's different. It's going to be the COVID vaccine by itself that day, and then again, the 2 week spacing between other vaccines if needed.
Okay, thank you. This next question, I think either for Steve or Bryant. Do you have any idea when Sanilac County will have enough vaccine for all residents 65 and over and those younger who are disabled?
I'll give Brian a little bit of a break, but I would encourage him to dovetail onto whatever I say or correct me if I'm wrong. But we've ordered, we placed an order for Pfizer, which is, they come in lots of 975 doses. And that would align with what Bryant has already received. So we're being told that Pfizer is a little bit more readily available, particularly right now, than Moderna. So I'm hoping that that continues to play itself out. And I think this is just going to get better and better in terms of the supply that we need in order to vaccinate the county. Bryant, what would you add?
That's exactly right. And I'll give you a little example just so people maybe can appreciate what's going on with the supply chain. And my understanding is that the federal government, the CDC, did open the supply chain up a little bit more this week. But for instance, last week's order to the state, there was 275,000 doses requested to the check at the state level for vaccines. 67,000 were allocated for this week. So you can see the math. It's a huge, significant difference of what's needed out there, requested, and what was received. And we were fortunate that with the health department needing the vaccine and switching to Pfizer, like Steve said, it is more available. We did so, and that's why you're going to see a combination of Moderna and Pfizer vaccine in our community for the time period. You can see the demand for it. And I think Steve's correct. I think we're going to see more of that become more available. And as we see the need for clinics and the vaccination rates going up, we will continue to order and cross our fingers we'll receive that vaccines for everybody.
Okay, thank you. There's a couple questions here related to the vaccine and allergies, including someone who's asking about anaphylaxis. So can one of you comment on just what that person should do or what the consideration should be?
I can take this on, sure. So the vaccine is recommended for everybody. However, there are people who probably should not get this COVID vaccine, especially if they've had any reactions to any of the components of the vaccine, which are available on any website or some handouts that your provider can give you. So in general, if you have an allergy to penicillin, sulfa, anything that's the usual allergies to drugs, you can still get the vaccine. What they do is they actually will vaccinate you and watch you for a minimum of 15 minutes. For those who've had reactions to vaccines in the past, they might watch them for a little bit longer, like 30 minutes. And wherever you get the vaccine, there will be medications to give in case you do develop a severe allergic reaction, such as epi or IV Benadryl, or you'd be sent to the ER if need be. However, again, the only contraindication to getting the vaccine is if you've had any reaction to any of the components of the vaccine, which are listed on the websites. One common ingredient is what we see in those pre-preparation drinks for the colonoscopy. So it's polyethylene glycol. If you ever had a colonoscopy and the day before the prep, you developed a difficulty breathing, a rash, difficulty swallowing, while drinking that drink called Go Lightly, then you might be one that actually has had a severe reaction to one of the ingredients. Now, having diarrhea and having to use the bathroom is not almost not an anaphylactic reaction. It's a side effect of the colon prep. However, it's how it works. So that's not considered a severe anaphylactic reaction to it. So by all means, talk to your provider about your allergy history. And actually, before you even get the COVID vaccine, they're going to give you a sheet of paper saying if you had any reactions to these medications or to these ingredients, do not get the vaccine. So you absolutely can get vaccinated with a lot of medical allergies.
Thank you. This question is about the need to quarantine if you're exposed to COVID, but you've had the vaccine. So if you have the vaccine, do you still need to quarantine if you're exposed to COVID? Let's see, I'm not sure who wants to answer this one. It sounds like Dr. Hammett again, maybe.
Sure. Yeah, this question is a very common one, and it's a very good question too. So the current CDC guidance, the recommendations will be to quarantine after exposure, even if you were vaccinated. But I will tell you that, as we've come to learn with the COVID and recommendations by the CDC, the more and more we learn about the body's reaction to the vaccine and how safe we are protected against exposures, the guidelines can change. So, but right now, to cover bases, the CDC saying, if you're exposed to COVID, even though you're vaccinated, you should still quarantine. But then again, the guidance might change, but let's wait for the CDC to make that call. And that's because we do know that it prevents severe illness to COVID. However, we're not sure about how effective it is against preventing carrier COVID or the asymptomatic spread of COVID.
Okay, we have a question for Dr. Sams about taking zinc, vitamin D, and C. I think a lot of us have seen a lot of things either online or just people talking about taking vitamins to boost our immunities to COVID. So can you comment on like dosing levels or if that's helpful?
Right. And this is where you kind of get into a little bit of, you can have a little argument about is it or is it not. I'm across the board believing multivitamin is a good thing. It acts just as a good little helper across the board. You have people that'll take multiple doses of vitamin C, like 500 milligrams, a normal kind of thing, but during the cold and flu season, increase it to 1,000. Well, again, nothing definitive, but it seems like having vitamin C, zinc, and vitamin D combination, all those, basically what it boils down to is they act as an anti-inflammatory kind of component that helps things from flaring up. And so again, not a big deal, but anything that can stack in our favor. And yes, I do recommend taking it. Now, look and see what you're taking. If you're already taking a multivitamin, it may already be in that. You don't need to take additional to that. On top of this, hydration across the board is another thing. But as I was talking about, I don't want to sound like Dr. Phil, but I mean, I was putting a great deal of depression. That is a big thing. It just takes the air out of your tires so much. So you don't need to just sit around and, think happy thoughts all the day, but there's something good to that as far as that goes. And it's easy. You don't have to look very far in today's in news or anything like that to just get bummed out. And I wish I could write a prescription for not to be bummed out, but I don't know if I can do that. But the positive attitude is there's nothing better than just a positive attitude, I believe.
Okay, thank you. So our next question, sounds like from a couple snowbirds. They're scheduled to leave for Florida on January 29th. They're both in their 70s. Does that mean they can get their first shot before they leave? Can they get their second shot in Florida? I guess, how would that work? I'm not sure who should answer this one. Maybe Bryant can handle this.
That's a good question. Right now we would recommend if they can hang out a little bit longer, get their shots where they're located and get the 2 shots. The Moderna's 28 days apart, the Pfizer's 21 days. I'm not so sure if they get a shot here and they go to Florida or first, vice versa. I'm sure we'll give them the second shot if they land here, but I'm not sure what Florida's conditions are in their supply chain and things of that nature. So we're trying to emphasize, we've heard this question on calls coming in. We're really trying to emphasize, stay put, get your shots, then do your traveling.
There is a second option. You could fly me down with you to Florida and I'll give you a shot.
That caps me. That's a good one, Doc.
It is, thank you. I think there's a couple questions here asking that if you've had COVID, should you still get the vaccine?
I take this one. Yeah, absolutely. So if you've had and recovered from COVID, so as long as you're not still sick with COVID, you should still get a vaccine. Now, if you're exposed to COVID, if you're in quarantine, don't leave quarantine for the vaccine, because by the time you're off quarantine, your immune system still hasn't been kicked in yet from the vaccine. So by all means, if you've had COVID and recovered, there's no reason you should not get a vaccine. Unless you have had allergies in the past to it. That's it.
It's Teresa, it's probably a good point too to point out that that second shot's very, very important to receive. And it's very important to get that shot within a 4-day window prior to your date from your previous shot or past that date. So you got a little bit of room in there. So if you have a second shot scheduled on a specific date with us or with McKenzie, and you can't, and specifically with the health department, if you can't make that date, we've got enough clinics going to be up and running that we can adjust your day 2 or 3. That's about it though, but it's very important to get that second shot. The first shot is one my understanding, and Doc could probably fill us in a little bit better. It's about 50% effective after a week. That second shot though is going to bring you up into the 95+% of effectiveness. So it's really a key to maintain. I got that first shot. Don't drop off and not get that second shot. It's very important to do so.
Yeah, I'll add to is that when you've had COVID and you recovered, you have some degree of immunity for at least 90 days. So if you have COVID, you don't need to rush to get a shot, because you do have some protection for at least 90 days, they say. But as Bryant mentioned, you prime your body with the first shot. However, you really get the beneficial. So the real big benefit comes with that second shot. That's probably what makes us different from actually having had COVID and recovered versus being immunized, is having 95% effectiveness with any vaccine is absolutely amazing. So you really want to get the benefit of the 2-shot dose. You really do.
Thank you. That's good information. So this question is apparently Governor Whitmer had said that all Mrna vaccines were going to be distributed through CVS and Walgreens. They had the Mrna shot through McKenzie. They just want to know what's being done to make sure that people get their second shot. So I guess, Bryant, can you comment on that?
So yeah, based on, just to make sure everybody understand, the CVS and Walgreens were hired by the federal government to do our long-term care facilities and utilizing the Mrna supply. So that's there's a little pause for the next 2 weeks. We're not able to receive Mrna. I'm sorry, get me back focused. What was the exact question?
I think that the person wanted to know, is there going to be an issue getting that second shot?
Yeah, that was it. Thank you. I'm sorry. No problem. So all our allocations, when we first receive Mrna or it's Pfizer, there's an automatic allocation for us to receive the second dose. And that second dose is allocated and sitting on the shelf waiting for us to order it. So there's not going to be a problem with receiving the second dose.
Okay, that's really good news. This person has heard that there's a shortage of nurses or people that are trained to give the vaccine. Is this true? And if so, is there a plan to recruit people to give these vaccines?
Well, I can respond a little bit, but Brian, I think you actually had that request out there in the news today, and it was, although not above the fold, below the fold. I'm told above the fold is the place to be, but you made it below the fold, and you were asking for people to call in who may have, maybe they're retired nurses. We put that list together early on in this whole pandemic because we weren't sure what the rush or the surge might be, and we might need to go to some of those folks that had retired. So we never had to, but I think the same thing applies now, Brian, right?
Right, and good to hear that is in the paper, but we also put it on our Facebook and website just a couple of days ago. And I'll tell you, here's the commitment to our community. We've received up to 30 individuals willing to help us either administer the vaccines or come into our facilities and help us monitor people that receive the vaccine. And these are people not just in our community currently, these are people that work and live in Lansing and St. Clair and Oakland area that travel to our area to see. I'm assuming they have parents or someone in the area that are willing to give up their time and their weekends to help us out. So that's just a testament to how we work in this community. It's a wonderful collaboration, but up to 30 people, and with it being in the paper, I suspect we'll hear from more.
Okay,
Yeah,
so
Teresa,
oh, sorry.
I think it's worth emphasizing, Bryant mentioned this earlier, and I think in a way he's mentioning it now. And that is that there are a lot of people who care about the Sanilac County community, and they're not from Sanilac County. They either come here to work, as Bryant pointed out, or they have summer homes up here, or they have family or relationships that they have built. So, I think our willingness to take care of them and certainly embrace and take the help that they're willing to offer speaks volumes to really the kindness and the friendliness of the people that do reside in the community.
That's a really good point, and I think we're very fortunate for that. So kind of a follow-up question was, if someone does want to volunteer to help out even with maybe the administrative parts of this process, is there a way for them to volunteer for that as well?
I think call Bryant.
I went to the wrong unmute button there. Sorry about that. Absolutely. The best way right now is there's an email. It's SCHD. I think it's dash volunteer at sanilachealth.com. SCHD volunteer at sanilachealth.com. Send us a little message, possible schedule, what your availability is, your background, and we'll get back to you as soon as we can.
Okay, sounds good. There's a question about should someone have a preference of which vaccine to get?
First available, whatever you can get. Because they work almost the same way, 94%, 95% effectiveness. Absolutely amazing. So first one you can get it, please. But make sure you still get, so make sure the second dose is of the exact same, vaccine you got. So if you had a Pfizer, get the Pfizer. If you have Moderna, get Moderna.
Okay, so this question's for Dr. Sams. Do you have suggestions for managing stress during the pandemic and just the challenging times that we're in?
Singing Kumbaya on a daily basis. I don't. If I did, I'd probably be a millionaire. I think the biggest thing is when you're in it by yourself, you really can be isolated. I think seek positive people around you. I mean, again, there's nothing magical about it. I say at this time also, I used the word serendipity before. Maybe this is the time that you're supposed to learn to juggle or turn your sights to playing guitar, something that outside your comfort, riding a unicycle, whatever it is as far as that goes. And I think those are the things that will take advantage of it. I had a really interesting thing, a kid when I was growing up, he broke his arm. He's a really good football player and he was going to be out the whole season. And this was before computers and keyboard. He took that time to learn to type. And who knew that the computer was going to be a thing, huh? But take advantage of those things for that. If you have questions, talk to your primary care provider about it. Sometimes these things you don't, especially guys, they don't like to talk about their emotions and things like that. So it's very important to get it out of there. So I will say this, while I have the platform right now during this whole conversation, I practice what I preach. And so I got the immunization, 2 weeks ago and like that. Well, I've been on texting with my sisters in Texas, and my mom got it. She's 90 years old and she got the immunization last Monday. Well, she now just tested positive for the thing. And she lost her taste yesterday, a whole bunch of words. My point being is we are so blessed in this community to have people to work together in a rural area. The area that I'm from is a very rural area in Texas. They have people that are working there. And I'm hoping that since I'm doing something good here, something good's going down there. But yeah, positive, positive, positive.
Thank you. So there's been a lot of talk about herd immunity, and I'm wondering if one of you could just comment on sort of how do we get there, and what's the percentage, and do people that have had COVID also, are they included in that herd immunity if they've already had it? So Steve, I don't know if that's for you or for Dr. Hamid.
I could start on it, I guess. Dr. Sands, I wish your mom the best of like full speed of recovery. From what I know, from what you tell me about her, she's a strong lady. I'm sure she'll do fine. So, you know, with herd immunity, that's a good question. They still don't know the exact answer, but the safest way to herd immunity is through immunizations, not through voluntarily getting COVID, because COVID has caused many deaths. Again, it's a third leading cause of death in the country. So we have to take this virus very seriously and try to avoid it at all costs. So the herd immunity concept would be if enough people in the population have had COVID and have antibodies to protect against it, or are immune, or if they developed immunity through a vaccine. So they don't know the exact number. Some say 70%, some say up to 90%. And that would include those who've actually recovered from COVID. But the caveat we don't know is how long will this immunity from the vaccine or even having had COVID last for? We don't know. So we assume that we still have to be very careful and take the precautions we know to help prevent COVID in the meantime. So again, there's no solid answer to that, but we do know that, you know, when we are vaccinated with a vaccine, we're at the full immunity, we help protect others around us from getting COVID in theory. So
I'd like to jump in on that as far as where immunization's going. I think sometimes once you have something happen, you kind of forget it happened. So I think it's important to, if you don't learn from history, you're damned to repeat it. So if we look back when we had polio going on in the late 50s, as far as that goes, the number of people that were on iron lungs and that were affected by that, they rose to the occasion. That's something we don't have anymore because we've used the immunization to get rid of it. I've had cases where kids one specific case where a kid was not vaccinated for meningitis going to college. And if he just had the immunization, he would have had a whole lot better outcome. My point being is this preventative maintenance is just that. The decisions you take now are going to be important. And to jump with what like Hamid was talking about is like, I don't care where you get it, just as long as you get it. And I think that's the importance of this. The best offense is a good defense. And so my point being is I'd rather treat somebody, give them the immunization to keep them from getting the disease or the virus, to treat them for it. Again, it's easier to keep the fire from happening than to put it out.
I'll just add too, you'll see numbers in the media from the state, and we have the objective to get everybody immunized, but to look at herd immunity, we're looking at a number of 80% of our population to give people a number. So if you look at Sanilac County's population at 42, you can do the math. We're about 32,000 that we'd like to see vaccinated from an administrative standpoint.
And I can't speak enough to the degree of difficulty. I'm not sure that, well, there were some expectations on the part of the state and the federal government that once we started receiving vaccines that we would have administered them, or 90% of them, within 7 days. Remember, we got ours 2 days before Christmas. So, the reality of trying to organize and begin to schedule people so that you're not wasting the whole logistics of actually administering the vaccine is far more complicated than here, you've got it, get it out there and let's go. It really took a lot more. And I think, the scheduling component, making sure that everybody knows when the next vaccine, when they are scheduled to get the next vaccine, and all the work that really Bryant and the health department are going to be taking over, having done some of that scheduling here at McKenzie for the doses that we receive, we understand that's a big undertaking. It's almost the easy part to actually, stick a needle in somebody's arm and give them the vaccine. So there's a lot that goes into this. I'm also reminded of many news stories where you see somebody who is on a ventilator, or they've recently gotten off of a ventilator, but they're critically ill. And it's at that point that we hear it time and time again. Boy, this is serious stuff. It's real. Get a vaccine. Yeah, that's really the shortest distance between point A and point B, if herd immunity is our overall goal.
And just to add to Steve's comments there, and you'll see that when we especially do go to the electronic administration of appointments, that we have clinics, but we're also building some other clinics, and we are going to propose some large mass vaccination clinics. So it's, for instance, like at the school, where we can do 300 to 500 people in a day. So for those who are waiting and indicating they want the vaccine and they know they're on a list, but you can get really impatient sometimes and you want to call a second time, please don't call that second time. We got your name. It's confirmed, but hang on. You're going to see a lot more clinics pop up through the community as well as the daily clinics that we're going to operate. It's just for the purposes of what Steve's talking about. The endeavor we're heading into is pretty massive, and there's barriers here and there, but we'll get through those and we'll get these vaccines out to everyone. And it's great to partner with McKenzie and working with them in order to get this done.
Well, there's one final question here in the Q&A, and I think that will be the last one because we're almost at 1 o'clock. But someone is asking if the second dose is the same as the first.
It is, yeah, it is the same as the second. So the first and second dose have the exact same amount of medication. Now, real quick, I'm going to jump on this one question somebody had in the wrong area of the chat. They put a question in the chat discussion rather than the question answer. It's a very important one to address. There's a lot of misconceptions there about fertility in the COVID vaccine and about pregnancy too. So number one, the study was not intended to be done on pregnant women. No study in the history of vaccines has ever started with pregnant women. It's unethical. They don't do that. So that's why there's not an answer to that. The second point I'm going to make is that there was a study of 30,000 people. When they enrolled them, they tested them for pregnancy. If they were pregnant, when they excluded them. You cannot be in the study. We're done. Sorry. However, they did follow women in the study, and they did a pregnancy test as a follow-up, months later. And of the 30,000 or so people that joined the study, 23 women got pregnant. Okay, and of that 23 women, it was 12 women who got the COVID vaccine, so we know it doesn't cause infertility, right? And 11 women who didn't get the vaccine had the placebo. So just a side note that all 12 women who had the COVID vaccine who got pregnant, so we know it doesn't cause infertility, they had successful pregnancies. And of the 11 women who got pregnant who had the placebo, 2 actually had miscarriages. So these are women, just like we see in the regular population, who have miscarriages here and there. Now, the worry about COVID, and I'll tell you this right now, is that COVID in pregnancy leads to hospitalizations for pregnant women. 25% of pregnant women who get COVID might need to be hospitalized due to severe illness. So we know that COVID can be a complication of, can cause problems in pregnancy, cause deaths of the women as well as the fetus or child. So we do know that the benefits of a vaccine very likely outweigh the problems that can be caused by COVID if you do get COVID. So again, the vaccines are absolutely, they do not cause infertility. That's absolutely never been proven with the COVID vaccine ever. So if you've heard it before, it's absolutely not true. There's not enough data out there to say it does. But from what you know, that for women in the study who were vaccinated, accidentally got pregnant during the study and had successful pregnancies.
I'm really glad that you brought that up, Dr. Hammond, because I've heard that out in the community a little bit, and I think that's a big concern. I'm really glad that you were able to address that today.
Yeah, so that's stemmed actually. I'm going to touch. I know we're out of time. It stemmed becomes back. So mumps virus can actually cause testicular swelling, infection too. So the mumps vaccine, way back when it was first made, it fought against the mumps virus and it caused some testicular issues too. Now that was how many decades ago, and that vaccine has since evolved. So that's where the whole misconception about vaccines and sterility, vaccines and fertility came from. And that's absolutely not true with the COVID mRNA vaccines at all.
Great. Well, thank you very much. I want to say thank you to our entire panel today for your time. Thank you to everyone for all of our participants and talking about these important topics. It's really good to get valuable and trustworthy information at a time like this. It's really important. Just want everybody to watch their emails for some upcoming events and invitations. Our next event is going to be the Go Red Ladies Night on February 25th. And this concludes our town hall for today. Thank you so much, everyone, for joining us.
Thank you.
Thank you.
Thank you, everyone.